So let's study Jihva Roga and treatment according to Ashtanga Hridaya, Uttarasthana and Sushruta. So let's see what are the Jihva Rogas mentioned by the Acharyas. So Sushruta mentioned 5 types of Jihvagata Roga, whereas Ashtanga Hridaya mentioned 6 types. The 5 types mentioned by Sushruta are Vadaja Jihva Kandaga, Pittaja Jihva Kandaga, Kabaja Jihva Kandaga, Alasa and Ubajihva. Same as mentioned by Ashtanga Hridaya, but Ashtanga Hridaya also mentioned Adi Jihva, Jihva Roga. So Sushruta mentioned 5 types: Vadaja Jihva Kandaga, Pittaja Jihva Kandaga, Kabaja Jihva Kandaga, Alasa and Ubajihva. So 3 Doshaja Jihva Kandaga plus Alasa and Ubajihva. Whereas Ashtanga Hridaya mentioned 6, and he also mentioned the 3 Doshaja Jihva Gadaroga, that is Vadaja, Pittaja, Kabaja, Alasa, Ubajihva as well as Adi Jihva. Adi Jihva is not mentioned in Sushruta. So which are the Jihvagada Roga mentioned by Sushruta? Vadaja by Vada, Pittaja by Pitta, Kabaja by Kaba. Alasa is Kaba plus Rekta according to Sushruta Acharya, and Ubajihva is also Kaba plus Rekta. So Jihvagada Roga occur due to vitiation of the dosha. Proper diagnosis helps in its effective treatment. When coming to Ashtanga Hridaya mentioned 6 times. So Vadaja, Pittaja, Kabaja and respective dosha. Alasa is Kaba plus Pitta. Adi Jihva as well as Ubajihva is Kaba, Pitta and Rekta. So there is a difference. So what is the difference? So doshas, Vada, Pitta, Kaba, that is respective dosha. When coming to Alasa, Ashtanga Hridaya mentioned Kaba plus Pitta, but for Sushruta it is Kaba plus Rekta. For Ashtanga Hridaya Acharya, Adi Jihva and Ubajihva both are Kaba plus Pitta plus Rekta. But for Sushruta Acharya, Ubajihva is Doshakaba is Kaba plus Rekta, and he does not mention Adi Jihva. Now coming to the Lakshanas of the Dosha Dushta Jihva, Vadaja, Pittaja, Kabaja, Jihva Rogas. First, Vadaja Jihva Roga according to Ashtanga Hridaya Uttarasthana. So what is this loga? Shaka Patra Ghara Supta Spuditha Vada Doshita. So what is the texture of our tongue? Texture is Shaka Patra Ghara, rough like a Shaka Patra or thick leaf. And what is the sensation? Suptatha or numbness. And there will be Spudita, fissures, deep cracks and fissure. Shaka Patra Ghara, Supta, Spudita, Vada Doshita. So let's see what is Sushruta Acharya described. Sushruta Acharya mentioned this as the Vadaja Kandaga. Jihva Anilena Spudita Prasupta Bhavecha Shaga Chadana Pragasha. So similar. Sushruta Acharya also mentioning Shaga Chadana Pragasha. So it is rough like a thick leaf. Spudita, there is a cracks and fissure, as well as Prasupta. Numbness is also there. So what is the difference? Both mention Shaga Patrakara or Shaga Chadana Prakasha. Suptada is the, Spudita is the. And the treatment. Ashtanga Hridaya mentioned Kuryat Vada Oshta Koboktam Kandageshu Anilatmasu. So the main as the which one? The same treatment as the Vadaja Oshta Koba. For example, Snehana, Svedana, Mrudu Ahara, Oshta Abhyanga, Vada Shamana, Aushada. So all the treatment mentioned in the Vadaja Oshta Koba should be done in the Vada Dushta Jihva. What about Sushruta? Oshta prakobe anilache yeduktam prakchikilsidam kandageshu anilotheshu tat karyam vishacha bhavet. So Vadaja Jihva Kandaga treatment is same as mentioned in the Vadaja Oshtakopa treatment. Next, Pitta vitiated tongue. So Jihva Pittat Sadaha Osha Rekter Mamsa Ankurehi Chita. So what is the texture? Rekter Mamsa Ankurehi Chita. So there will be eruptions. Numerous red fleshy eruption. That is a Rektehi Mamsa Ankurehi Chita. And what is the sensation? Burning sensation. Daha. Osha is intense heat. So Pittat Sadaha Osha Rektehi Mamsa Ankurehi Chita. This is mentioned in the Ashtanga Hridaya. What about Sushruta? Pittene Pida Paridahyadecha Chida Sarekterabi Kandagaischa. So Pida. Here Sushruta Acharya mentioned there is a change in the color of the tongue. The color become yellow. Maybe due to excess bile. Pida, yellow colored tongue. Paridahyadi. So there is a dahana, burning sensation, intense fiery burning. Chida sarakterabi kandagaischa. That means studded with furred blood color. Bumps like. So there is the blood colored painful bump will be there. So Pida Paridahyade Chida Sarakterabi Kandagaisha. So what is the difference? Ashtanga Hridaya, the term is Sadaha Osha, Sushruta Paridahyade. Rekter Mangsangurehi Chida, Chida Sarakterabi Kandagaisha. So one mentioned Mamsangura, Sushruta it is Kandaga, Rekta Kandaga. And Sushruta Acharya mentioned the color also, Pida. Next, Pittaja Jihva Kandaga treatment. So first, Ashtanga Hridaya, Jihvayam Pitta Jadeshu, Grishteshu Rudiram Sruti. So first we are scrubbing the tongue. Why? To remove the blood, dushta blood. So this induce, scrubbing the tongue gently induce mild bloodletting. The next is step 2 is cooling treatment. Pradisarana Ghandusha Namaram Maduraihi Hitam. So with Madhura Aushada we are doing Pradisarana, Ghandusha and Nasya. Then Sushruta Acharya mentioned Pitta Jeshu Vigrishteshu Nisride Dushta Shonide. So to drain the bad blood, that is a Dushta Shonida, we are rubbing with Shagodaga leaf. So rubbing with rough surface like the Shagodaga leaf. Next, Madhura Upachara. That is Pradisarana Gandusha Nasyancha Madhura Hidam. Same we told in Ashtanga Hridaya. That is a Pradisarana Gandusha Nasya using Madhura Ushada. The next, Kabajihva. Shalmali Kandagabaihi tu Kabhena Bahalam Guru. So Shalmali Kandaga. So what is the special feature of Kandaga here? That is an eruption. It is Shalmali Kandagabe, resembling the thorn of a Shalmali tree. Then Guru, the tongue feels Guru or heavy, and Bahalam thick. What about Sushruta? Almost same. Kabhena Gurvi Bahula Chidacha Mamsodkamaihi. Shalmali Kandagabe. So here also they mentioned the Mamsodkama. It is like a Shalmali Kandagaba, also Guru and Bahula. So almost same, Shalmali Kandagabe, and Sushruta mentioned Chida Mamsodgamaihi, Shalmali Kandagabe, Bahala, Guru. Both, all the three are mentioned by both of the Acharya. Now treatment. First, Tikshnehi Kapoteshwe. Tikshnehi Kapoteshu Evam. Cha Sarshaba Trayushanadibihi. So here they have mentioned the drug for the scrubbing. With what? Sarshaba Trayushanadibihi. So Sarshaba, mustard. See, Trayushana means Marija, Pipali, Shundi. So scrub the tongue gently using the Tikshna, Ushna drugs such as Sarshaba Trayushanadi to clear the excess kaba. Now, In Sushruta, Kandakeshu Kapodeshu Likiteshu Asrajaha Kshaye Pipalyadihi Madhu Yudaha Grihe Niyad Karyastu Pradisarani Gaura Sarshaba Saindavahi Kavalam Shabi Padola Nimba Vartago Shari Yushescha Bhojayed. So first Chigilsa is Lekana. Kandageshu Kaphodeshu Ligideshu Asar Jakshay. So why we are doing the Lekana? So this is Lekana. Shalmali Kandagaba is there, right? So to surgical scrapping of this thick kapha thorn using Mandala Patra blade also. So Lekana it is mentioned to drain the excess kapha fluid and blood. After Lekana, Pradisarana. Pipalyadihi Madhuyutaha Grahniyad Karyastu Pradisarane. So Pradisarana with Pipalyad Churna plus Madhu to remove the rest of the kaba. Then third is Kavala. Gaura Sarshava Saindavaihi Kavalamsha Abhi. So Kavala means that is a gargling using the Gaura Sarshava, white mustard seeds and Saindava. A mixture of the Gaura Sarshava and white mustard seeds. And the Patya, that is a dietary therapy. Padola Nimba Vartago, Kshari Yushishcha Bojit. So, what should be the food? The food with Yusha made with Padola Nimba Vartago Yavakshara should be taken after all this treatment. Next is Alasa. Kababittadaha Shobho Jihva Stambakrit Unnadaha Matsyagandir Bhavit Pakwaha So Alaso Mamsa Shadanaha. So Alasa is a sublingual abscess or severe inflammation. And it is said it is located beneath the tongue. Alasa Midhana Kababitta imbalance. Ada Shoba. There is a raised swelling. Unnada Ada Shoba. So this is a raised swelling where Ada. Shoba is Unnada, but Ada under the tongue. Jihva Stamba. Stiff locked tongue. So Kabapitta is the Nidhana. Ada Shoba Unnama. Unnada. Shoba is raised swelling under the tongue. And this result in Jihva Stambakrit. Plus Matsyagandhi. What happens when Pakwa, this become Malsyagandhi, rotting fishy smell. Mamsa Shadana, causing the necrosis or sloughing of the muscular tissue also. What about Sushruta? Jihva Taleyaha Shvayadu Prakadaha So Alasa Sapnya Kabarekta Murti. So what is the dosha predominance mentioned here? That is Kabha plus blood. Jihva Tale. So this is in the under surface of the tongue. And Shvayadu Praghadaha. Severe inflammatory swelling is there. What are the symptoms? Jihvam Sthambayadi Pravarto. So when it is grown, it make the immobilize the tongue. Jihvam Sthambayadi. Moolam Brisham Idi Pagam. So Moola at the root, it becomes Paga. It undergo rapid suppuration or Paga. So what are the difference? One is Kabapitta, Sushruta Kabarekta, Ada Shobha, whereas Sushruta mentioned Jihvatala Shvayadu. Both of them is Jihva Stamba mentioned, Unnada Shobha, Praghada Shobha, Matsyagandhi. When Pakwa it is Matsyagandhi and Mamsa Shadana will be there, whereas Sushruta mentioned Moletu Jihva Brishamedi Pagam. When it is Moolam, in the root, it acquires the suppuration fast. Next, treatment. Ashtanga Hridaya mentioned Nave Jihvalase Abhiyevam Tam Tu Shastrena Na Sprished. For Alasa, which is new, the treatment is the same as before, but what? It should not be touched with sharp instrument. Na tu shastrena sprished. It should not be touched with any sharp instrument. So we can do the previous treatment, but what? It should not be touched with sharp instrument if it is new. Sushruta didn't mention any treatment. Next is Adi Jihva. That is also only in Ashtanga Hridaya. Prabandhane ado jihvayaha shobho jihvagra sannibaha sa anguraha kaba pittasra lalo osha stambhavan gharaha adi jihvaha saruk kandu vakya ahara vighadakrit. So what is the location? Prabandhane adho jihvaya. So the location is under the root of the tongue. And what is the appearance? Jihvagra sanniba. It appears like a second tongue. It appears at the tip of the tongue as a second tongue. And what is the dosha here? Kapha, Pitta, Rekta. It is mentioned only in the Ashtanga Hridaya. Sa Anguraha. Covered or studded with tiny sprouts or growth or Angura. Vakya Ahara Vighadakrit. So what happens? There is obstruction in the speech, swallowing also. Symptoms are Lala, excessive salivation, Usha, Osha. It is heat or burning, Stambhavan, rigidity and loss of movement, Ghara, rough to touch, Saruk, with pain, Kandu, itching also will be there. And Adijihva is not mentioned in Sushruta. Adijihva Chikitsa. Unnamya jihvamagrishtam badishena adijihvikam chedayet mandalagrena tikshna ukshne garshanadi cha. So first, the tongue is held by the badisha yantra. It is lifted up and the extra growth of the muscle is cut off using the Mandalagra Shastra. So here the Badisha Yantra is mentioned, also the Mandalagra Shastra. Then after this what? The Tikshna Ushna Garshanadi, rubbed with Tikshna Ushna drugs. So first is the tongue is held by Badisha Yantra, lifted up by the Badisha Yantra. Extra growth is cut off using the Mandalagra. Then Garshana using Tikshna Ushna drugs. Upajihva. Tadrak eva upajihvastu jihvaya uparistida. So this is Tadrik eva. Like Adijihva itself, there is swelling, lala, pain, pustule. All this will be there. Plus, where it is location? Jihvaya uparistida. Means it is located above the tongue, top of the tongue. So that is the only difference between the Adijihva and Upajihva. That is the location. Jihvagra rupaha shvayatu hi jihva munnamya jadaha kabarekta yoni. Here they have mentioned the Sushruta mentioned the dosha as kapha plus rekta. Shvayatu jihvagra rupa. So there is a cystic swelling like a tongue tip. There is a cystic swelling. There is a shvayatu plus the location. Jihva munnamya appears about the under surface. It appears jihva unnamya. It appears like it has lifted the jihva. And what are the lakshana? Praseka, excessive drooling, salivation, kandu, intense itching, paridaha, a serious burning sensation. And treatment, Ubajihva parisravya yavaksharena varshir. Ubajihva should be drained out by the application of the yavakshara. Sushruta mentioned the treatment as Ubajihvantu samlikya ksharena pradisarayet shiro virega khandosha domaischa anupacharayet. So lekana and pradisarana. Lekana means first it is rubbed. So lekana, it is scrapped. Then pradisarana, rubbed with kshara. Ubajihvantu samlikya ksharena pradisaraya. So first is lekana, then rubbed with kshara. Then shirovireka khandosha domaischa shirovireka khandosha domaihi cha ubacharet. So then next we do shirovireka khandosha and doma. Okay, so here ends the Jihva Roga. Thank you for watching my video. For any doubts, please post in the comment section. Please like, share, subscribe my channel for more update. Thank you.